Okay, so in order to make your arm for lab draw, IV starts, and IV push medication administration, you're going to need your bag of 500 ml normal saline, a roll of duct tape, 3 milliliter syringe, blunt tip needle, food coloring. Color does not matter, it just needs to be liquid, and then the primary IV tubing set, and an old body bath towel, not a beach towel, not a hand towel, that's old and ready for the trash. Okay, so we're going to take this opportunity when we're drawing up the food coloring to color your IV fluid to go ahead and work on practicing some sterile technique. So the first thing that you want to do is with your blunt tip needle, you want to go ahead and open it up, and you want to avoid touching any more of this than you need to on the inside of that to try and keep the inside of the outer wrapping sterile. Then you're going to go ahead and open up your 3 ml syringe. You're going to pull your 3 ml syringe out, and you're going to attach it to your blunt tip needle. Then you're going to leave the cap inside the sterile sheath, and then you're going to go ahead and take your cap off your food coloring, if this is the kind that you have, and you're going to take and sit your food coloring there, and you're going to bring your blunt tip needle to the top. Make sure they're touching before you bring your fingers in so that you don't risk hurting yourself. You're going to turn it upside down, and then just draw back, depending on how red or how blue or how green you want your fluid, draw back 1 ml or 2 of food coloring. And then take it out and put your cap back on so you don't make a mess. And then if you were giving a medication to a patient, you would want to slide your needle back into the sterile cap, and then you're ready to take your medication to the bedside. All right, now you're going to take the cap off. You're going to take your 500 ml bag very carefully, have the blunt tip needle hit the rubber, put it in, and then just add your food coloring. And when you bring it out, be careful because it will spray sometimes and you don't want to get it all over your counter or anywhere else. And then you can just put the cap back on, and you can use this later for practice with something else. Okay, so I've taken the IV tubing set, the full long free flow set, out of its package. The first thing I'm going to do is take the roller clamp and push it as far down towards the bottom as I can get it, and I'm going to close the roller clamp. Then I'm going to take the top clamp and I'm going to push it all the way as far up as I can, and I'm going to clamp it shut. Then after that, again, I'm going to try and use some sterile technique here. I'm going to loosen this cap up because it's on really, really tight when it's brand new. This is really pull hard. Mine has been reused, so I'm going to have to be careful not to get red stuff everywhere. Yours won't do it. Mine just did because it's sealed. And then I'm going to take this cap off, drop it so that I maintain sterility here and here, and then I'm going to put them together. After I do that, I'm going to invert the bag, and then I'm going to squeeze the chamber and very slowly release it to try and minimize the number of air bubbles that I get in there. And then I'm going to squeeze it one more time and slowly release until I have the chamber about half full. Then I'm going to unclamp the top clamp, and then I'm going to lay it down for a second, and then I'm going to take the bottom cap off, have it laying on the towel, and then I'm going to open the roller clamp, and as soon as the fluid gets all the way to the bottom and I've gotten all the air bubbles out, I'm going to close the roller clamp back, and then I'm going to lay the bag down and close the clamp back. Then I'm going to put the cap back on the bottom, but not too tight. You want it on there loosely, or you're not going to be able to let more fluid go when you need to when you're practicing on your IV start and your lab draws. Okay, so now I've opened up the body towel, and I'm going to take and unfold it out and make it flat and to where I have it as even as I can get it. And then I'm going to start from this end, and I'm going to tightly roll the towel to make my arm. And after I've got it nice and tightly rolled, and you might need somebody to hold the ends for you so that it stays flat, I'm gonna get my duct tape, and I just need to, for right the moment, I need to go ahead and secure the towel to itself. So I'm going to put my first piece of duct tape and secure the towel to itself. Okay, so the first thing that you want to do is with the bag where the clamp is, give yourself a couple of inches off the top end of the towel. Put a little piece of tape at this end, little piece of this tape at this end. Make sure you give yourself a deep set loop here, because if it bends further, it'll kink off and you won't get to see a flash or a blood return. And then you're going to tape down that end and tape down that end. Again, make sure that this cap is on but loose, and then you want to take that in and you want to slide it into the center of your towel as far down as you can get it, so it absorbs any fluid once we open the clamps for further practice. And then after that, you're going to take your duct tape and you're going to run your duct tape over your IV tubing, because this is going to simulate the vein. Now, you'll notice here that it's just a little bit crooked. That should not affect you being able to thread it, and it should make it a little more also like simulation, like you'd really see. And then in order to give your arm the sturdiness like a human arm, you're going to want to go duct tape from one end to the other. Just don't go over the tubing itself with more than one piece of duct tape, because then it may be too sticky for you to actually be able to push your IV angiocath all the way through it. Okay, now you can see you've got an entire wrapped, sturdy arm. You'll be able to put the tourniquet around here to simulate putting a tourniquet on the patient. You'll be able to palpate the tubing, which will feel like veins, and you've got 2 rows of tubing to practice with all the way down. It's pressurized so that when you put the angiocath in, you'll be able to see a flash, and when you attempt the lab draws, it will fill up your tube. If at some point it needs to be repressurized, all you need to do is unclamp this and give it a good squeeze while squeezing the bag, and then go ahead and clamp it back. If you poke excessive holes in one spot, you might spring a leak. All you've got to do is take a piece of duct tape and put it right over the top of that leak, and then start sticking your angiocaths and your butterflies and stuff for lab draws in a different spot.